Thank you, Mr. Chair, and thank you, committee members, just for being here, our board members. Just a question about reimbursement for community care providers. We got to hear from them and just some of their struggles with why are they not accepting some of our patients that we're referring to. They had concerns about their reimbursement rates and about the time it was taking for them to be reimbursed. Can you tell how competitive we are when looking at community care compared to the VA system? Is the compensation competitive, or do we look at that even when we're thinking about compensation?
Thank you for that question, Congresswoman. In terms of processing claims, in general, VA has been pretty good about processing clean claims. I believe over 95% of these clean claims are processed within 30 days. I don't have the exact numbers for RRTP programs, but we can get back to you if needed. In terms of a reimbursement, we follow Medicare rates in general, but there are lots of nuances about reimbursement. I believe we are competitive, but if there are specific questions about a particular CPT code or those kind of details, we are happy to work offline and try to clarify those questions.
There's just a comment that I've heard more than once about why they can't take VA, or they don't want to contract with the VA because our reimbursement rates weren't competitive for them. And there's such a shortage of mental health providers in the community and a VA throughout the country that, I just want to make sure we're prioritizing staying competitive so that they are incentivized to be able to see our patients. And so I represent Hampton Roads and recently got to talk to and visit the Hampton VA, which is doing a great job. Their two complaints were that they wanted more space and they needed more people, which I think is kind of our universal complaints. But their mental health department, I think they're doing good work. And overall, I just want to say thank you, to them. I know it's a hard job. I know that as a nurse practitioner, I know nurses especially have been asked to do a lot during the pandemic, especially in the mental health field and all providers. So I want to thank them because they are doing good work out there. One of the things I hear about and that I'm concerned about as well is when we have these great inpatient programs that we send our veterans to for substance abuse, for any mental health as depression, anxiety, suicidal ideations, we stabilize them and have them there for however long it takes, and then we release them back to the community, back to their homes. And that continuity of care piece, you guys talked about it a little bit, but we see it, I saw it, in my practice. It's like we lose them to the community, right? So how are we ensuring that when these patients are discharged, I'm sure there's a discharge planner that makes sure they have a follow-up appointment, that makes sure they go home with their meds. On the State House level, I know we were pushing for things like home health to actually visit the home, because leaving the motivation just with this patient, and they're already probably struggling in their family and a lot of questions, new side effects of medication, transportation issues, all those things. So my desire was to have someone actually visit the home. There's so much benefit. We can get to see what that home environment looks like. So that continuity of care piece, whatever that looks like, is it home health? Is it, what is the VA doing to just ensure that, is it utilization of nurse managers, to make sure that we are really thinking of all the issues that veterans struggle with once we get them stabilized so that we don't lose them to the community?
Thank you for that question. And we do have full comprehensive continuum of care that includes, as we mentioned, inpatient, which is the most restrictive, all the way to outpatient services, as well as leveraging our peer specialists and that provide a lot of coaching. The uniqueness about VA peer specialists is that they have a veteran lived experience. And so they're able to rapidly build rapport with our veterans. We certainly are able to leverage telehealth services so that when the veteran reintegrates in the community and is competitively employed, we can utilize that service so they don't have to spend time away from a job that they've been newly employed to. And then we have multiple award-winning apps that can be downloaded for the veterans' use. Thank you.
And they're utilizing those things. Someone is going behind them and making sure they're utilizing one of those great services.
Yes, we are.
Thank you. Thank you. I yield back.